If you've recently had a C-section or a surgical incision and you're wanting to take the best care of it, there are essentially 3 steps that we recommend doing from around 4 to 6 weeks after you give birth, so after your C-section or after any sort of surgery, but only once you're cleared by your treating surgeon. So essentially what we can do is apply silicone tape or silicone strips. We can do massage with either our roller or our massage tool, and we can also do massage and make sure it's moisturized with our oil. So I'm going to take you through those 3 steps. So the first thing that I would do is use the oil so that then we can wipe it off and clean it before we pop the strip on. So this will take you less than 5 minutes. We ideally want to do this every single day if you can, but particularly if you've just had a baby, we know how hectic that time can be. So this is our scar and skin oil. Essentially what we want to do with this one is if you've had a C-section scar, so an incision through here, let's show you. We want to pop a couple of drops onto your tummy, or you can put it onto your fingers. And then we just want to initially start with massaging it in to the area, just nice and gently. And particularly if you're early days and you're still quite sensitive and it feels still a little bit gross, just go nice and slowly with this. We take some time to just kind of massage it in. Make sure you're not holding your abs in, so take some deep breaths, really let it go. So then I'm going to use our roller. So it's got 2 ends. We've got the spikier end and then we've got the flatter end. So I'm just going to start with this flatter end. This end is really, really, really good for sensation. So if you're feeling a little bit numb, if you're feeling a little bit like, oh, I don't really want to touch it, this end can be really good. This end you can kind of do a firmer and a more deeper massage with. So I'm going to use this end initially, and I'm just going to move it up and down initially, all the way along the length of a scar and all the way to at least 2 to 3 centimeters on the outside of the visible scar, because we know that scar tissue extends much deeper than what we can actually see. So just moving up and down initially, then we might go across, above the scar, kind of up towards your belly button. Now I've got quite a firm pressure. Okay, probably would be, if I was, checking the ripeness of a tomato and avocado, slightly firmer than that. And you can go quite, it really depends on your tolerance level, but you can go quite firm because we're trying to move the tissue around. And remember, if you kind of start to lose some of that oil or some of that lubrication, then definitely pop more on. But essentially just move it in a few different ways along the length of the scar. Now, if I had a lot of puffiness through my scar, or if I wanted to shift some fluid before I did kind of the sensory stuff with the other end, I might use our massage tool to just get rid of some of that fluid. So I might come across and up. And again, you can put as much or as little pressure as you like through this. Same thing on the other side. So you're kind of just going below the scar and moving that fluid. Or you might be going along the scar and moving down. So the aim is just to get that fluid moving, get the stagnancy of it moving and opening along the length. Okay. Then I might progress to using this end of the roller, which is going to be, again, like I said, for more sensation. So you might roll along the outside, come all the way to the middle. You can focus around any areas that you feel a little bit more sensitive or a little bit more numb. And you can apply, I wouldn't personally, if I'm new to doing this, feel like it feels nice to put quite firm pressure through this end. But as you get further and further into your treatment, you can also go quite firm with this one. But going along the same sort of areas and the length of that scar tissue. What you would do once you finish that massage, you've done kind of 2 to 5 minutes worth of massage depending on time, is pop on a silicone strip or some silicone tape. So I've got our silicone scar tape here. You just cut the length that you need. So if you've got a C-section scar, just cut it so that it's maybe 2 or 3 centimeters slightly longer than the scar. And then what I like to do with it is, so I've cut it, I then fold it over, and then I just round the edges, and I just find it catches less on your clothing, so that hopefully it lasts for longer. And you just peel it off. And essentially, remember, we've taken that oil off, so maybe jump in the shower and then put this on after the shower. And then we're essentially just popping it over wherever your scar is and then patting it down. So I didn't wash my belly, so this probably is not the perfect demonstration, but you won't have oil on there, no moisturizer, just on your fresh skin. Make sure it's nice and flush along the length of your scar. And then you can leave it on until your next shower and then take it off again. These have really good research behind them that show that they they decrease redness and improve the appearance of scars, potentially decreasing keloiding. It can also help with the raised nature of scars. So they're really, really quite good. Irritation and itchiness can also be improved with their use. So really highly recommend them. It's kind of the 3-step routine that I would recommend most of my C-section mamas do on a regular basis where able. If you can't do the massage because you've run out of time, then even just touching it through your clothes when you're breastfeeding can be helpful, and wearing the silicone strips can be really, really beneficial because all you have to do is put them on, so you don't actually have to spend any time doing anything else besides putting them on. They can be reused, so you can then wash them underwater, so rehydrate them, leave them to air dry on some paper towel, and then once they're dry, the stickiness should come back and you can reuse them. You can find more information via our website, bn.com.au, and if you have any questions, then let me know below, but hopefully this was helpful.